Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Femoral triangle. So here in the femoral triangle, it is a depressed intermuscular space and in the anteromedial aspect of the proximal thigh. Now let's look into the boundaries and also the contents. So boundaries is medially, it is the adductor longus. And when you look at laterally, it is the medial border of sartorius. Next is what is present in the base. The base is, it includes the inguinal ligament. Base includes the inguinal ligament. And then comes the floor. Floor, what is a floor? There is a lateral to medial. It includes the iliacus, then the psoas major, the pectineus, as well as the adductor longus. So all these forms the floor. So laterally it is the medial border of sartorius, medially the medial border of adductor longus. So what is the roof? The roof includes the skin, superficial fascia, the fascia lata, then comes the superficial branches of the femoral vessels. That is, it includes the superficial epigastric, and then the superficial external pudendal, and there is a superficial circumflex iliac vessels as well as the GSV. Now comes the contents. The contents is, it includes the femoral sheath, and this contains the lymph node of the cloquet, the femoral vein, the femoral artery, as well as the femoral branch of the genitofemoral nerve. Next is the femoral nerve and its branches. And next other content is, it goes the lateral femoral cutaneous nerve of the thigh. To learn and grow daily like this, please do subscribe.